let me first introduce myself. My name is Arun Kumar Prasad and I am a dermatologist by profession. My experience in this profession is of about 43 years, and I am mostly dealing with clinical dermatology and a little bit with cosmetic dermatology as well. Today we will have a small talk about the Excimer laser. We are using the Excimer laser to treat a very common disease. It's called vitiligo. Vitiligo is a disease in which the patient's skin starts turning white in patches. Vitiligo is usually asymptomatic. The patient doesn't really feel any discomfort because of the disease, but in certain communities and certainly in India, especially in countries where primarily the skin is colored, vitiligo carries a lot of social implications. So in certain communities, it is very difficult for a person to get married if he or she is suffering from vitiligo, and sometimes even if one of the parents is suffering from vitiligo, it is difficult for the children also to get married. So it definitely, although it may be asymptomatic, it definitely carries a lot of social connotations. We are really not very sure, but we think it is an autoimmune disease and possibly it is a genetic disease. An autoimmune disease, the body of the patient produces certain antibodies, and the antibodies go and attack some organ or some cell and damages that target, resulting in disease. So what happens in vitiligo? We are almost sure that antibodies are being produced which go and attack the melanocytes in the skin, and the melanocytes' job is to produce melanin pigment which gives the color to the skin. So if the melanocytes are damaged, then the skin starts turning white. Now, if someone asks why is it that these antibodies are being produced in vitiligo patients, scientists have not been actually able to answer this question. There may be a genetic background, but statistics, when we ask the patient whether there is a family history, then only 3 out of 10 patients actually tell us that there is a positive family history. If we look at the way we have been treating vitiligo, it has been with some medication followed by exposure to sunlight. Now, there are a lot of ifs and buts about sun exposure because it is difficult to measure the quantity of the ultraviolet light present while we are exposing to the sun, and sunlight is something that is not really under our control. So depending upon the season, the weather, so the sunlight may or may not be as effective. So further down the line, we got machines which used to emit ultraviolet A, ultraviolet B or broadband ultraviolet light, and we started combining medicines with this light, or narrowband ultraviolet B actually works even without taking any medicines. So we started this kind of therapy and it was working well, but in some patients we found that the treatment results were not that good, or they were very slow. And then the next thing that came out was the Excimer laser. So Excimer laser is basically a laser which emits a particular wavelength of light. It is actually 311 nanometers, and with the laser the penetration is much better than with a normal phototherapy unit. So that is why we say that the Excimer laser is probably the best option for treating vitiligo. Of course, there are still certain advantages to one of the older methods like phototherapy, because with a phototherapy machine we can expose the entire body, whereas with an Excimer laser we are only able to expose a small part of the body. So Excimer laser is actually meant for patients who have small patches of vitiligo, where we don't actually need to expose the rest of the body. And the deeper penetration theoretically should produce faster and better results. Overall, again, I'm quoting statistics. So overall, we would say that about 75% of patients can achieve excellent response with treatment. We can't say that 100% vitiligo patients will achieve this the excellent response. Yeah, so again, with any autoimmune disease, we cannot say that the results will always be permanent, because we don't know why wrong kinds of antibodies are being produced in the patient. We can't say that, okay, with this treatment, we have suppressed the wrong antibodies forever. So if the antibodies again get generated, then any autoimmune disease can relapse, and so can vitiligo. So Excimer laser actually requires a very short time, much shorter than conventional phototherapy and shorter than sun exposure. The number of sessions is totally unpredictable. We can have a very quick response in a few sessions, or it may be a prolonged treatment. And as I said, 75% of patients have excellent response. So obviously the other 25%, they may not have that good response, or some may actually fail the treatment. We have to understand that about vitiligo. Well, with vitiligo, since there is no melanin pigment in the lesion, the area which has turned white is unable to protect itself from sunlight. So every vitiligo patient should be told not to sun expose. Obviously, when we have put the patient on some medication followed by sun exposure, then it becomes even more important to tell the patient not to sun expose at other times. And similarly with phototherapy, as well as with Excimer laser therapy, we are giving some kind of sunlight, artificial sunlight from a machine. So we should tell the patient not to expose to the sun at other times, because the patient's skin is already sensitized with light from a machine. As a dermatologist, I have my practicing clinics at two branches of Wizderm clinic. One is in Jodhpur Park and the other is in Shakespeare Sarandi, and we have Excimer laser machines available. So anybody suffering from vitiligo, if he is interested in this form of therapy, they can always consult me at these clinics.